bias, the best month of the year. Sorry. Um, Welcome to this month of July Health Equity Workgroup monthly meeting. If you've joined us for the first time, we definitely love for you to unmute yourself and present your name and any affiliated organization. And if you are not with us for the first time, welcome back. Thank you again for joining, and please do the same. And it looks like we have an icebreaker for today. What motivates you to continue championing for health equity? Yes, it is my birthday next week. Again, welcome, welcome. Please place your name in the chat as well as the organization if you are affiliated with one. And our question of the day is what motivates you to continue championing for health equity? And you're welcome to either put that in the chat as well or to unmute yourself and say it out loud.
Oh my goodness. I guess I'll go ahead and model as a co-chair. And what motivates me to continue championing for health equity? Well, I think just being able to see the impact of what we do on the communities and programs, policies, whatever it is. I think everybody's angle is a little bit different, but so the impact may be changing. But I think even just seeing people's eyes open to the impacts of just thinking about equity and what it means and what's inequity and what leads to inequities is that motivates me to continue championing for health equity.
So in the chat, I see making a difference, motivated by the many partners we have in space. I think for me, being in the academic environment, it's just the constant learning about health equity and what that would mean for our future healthcare providers, right, in patient care. It's just transferring that information that I'm receiving from the many different partners that we work with, and applying that knowledge to those who are out in the community, out in our healthcare system, taking care of the people exactly who they're serving. So that's what continues to motivate me.
I can go next. Hi, everyone. For those who I have not met yet, my name is Taylor Palmer, and I'm with the Prince George's County Health Department. I put in the chat that I'm motivated by all of our partners that we have in this space, but also in talking about all of the resources that are out there now for health equity. I've been really excited to see the number of resources and all of the trainings that are now becoming available, and that so many seats are becoming open at the table, and they're more accessible to be able to learn more about health equity and be able to champion for equity. So really glad to see that, and really thrilled that this group could be a part of that change.
What motivates me is the desire to see healthcare be responsive to the needs of all of the communities that need to be served in an equitable way. And I feel like nothing is going to change until there's a major systems change again, in terms of reducing fragmentation, making common sense healthcare available to everybody in the community, and ensuring that everybody in the community is treated justly, fairly, and equitably within a system of care that's responsive to community needs. I've been doing this for a long time, and I'll tell you, to have to keep revisiting things like reproductive health and reproductive rights, and you know, I just don't want to have to get myself arrested anymore, but it may come to that.
Hi, this is Sharon Gibbs Cooper, and I do apologize. I'm having some technical difficulty with my camera, but I'm going to echo with what everyone else says. It's the motivation is surrounded by knowing there's a need, knowing that there's resources out there, and when we galvanize those resources, working together to address those gaps, and how do we work together in doing so. Again, we shouldn't, a zip code should not determine how, when, and the outcomes of care. So what can we do to bridge that gap? Working, closely with these dynamic folks around this table and looking at transformative avenues or solutions that can be used in leveraging our resources in order to address those ills and build sustainable models, and incorporating, as you all are doing, those who are most affected.
I was just gonna say, I think what motivates me to continue the effort and towards health equity is just the movement from discussion and training and learning and education to actual change. And so that we start to see, instead of just the areas of disparity and the discussion around health equity, but that we're actually moving towards action, like things are actually starting to be impacted in a meaningful way.
Yeah, and I would absolutely say too that it's when we have our politicians and legislatures who are helping to make those changes, when they have their own aha moment and they get it. And so that kind of helps propel, what we're working so hard to achieve the community. So that's another aspect that continues to motivate me as well.
Are there any more introductions, or are we ready to move to our next slide?
Oops. Hi. Can you hear me?
Yes.
Hi, I'm sorry. Sorry for attending later, but my name is Stephanie Burke. I am with Prince George's Community College. I am the program director as well as the associate professor for community health and health navigator.
Thank you for joining us, Stephanie.
Welcome.
Thank you.
So on our agenda today, we have a presentation by Dr. Sharon Gibbs Cooper. She comes to us from the University of Maryland Institute for Governmental Service and Research. And then we'll talk a little bit about our Health Equity Champions resource inventory, something that we've been working on with for quite some time, community announcements, and then we'll adjourn for the evening. So during each meeting, we typically like to share the vision so that we continue to keep this in the forefront of what we do as we're talking about impact and change in our community. So the vision is that Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender, gender identity, or health literacy skills. And I'll turn it over to Christine to just share a little bit about the goals that we have for our work.
And so, yeah, thank you, Sarah. So we have, for those of you who are newer, who haven't been in attendance in a while, we have a work plan for the work group. And we like to start each meeting and link the actual contents and the agenda of the meeting back to what we're talking about, back to specific objectives within our work plan. And so today, you know, the contents or what we're talking about today will address two of those. First, the first objective 1.1 to align the goals of this work group with county council and board of health priorities. One of the things that we and also is to actually, forgive me, I'm just coming back from vacation, so my brain isn't as it should be. But actually, today we're largely talking about the HIAP part of the Health Equity Champions program. But I know there's another one, forgive me, there's another one where we actually get, we talk about presentations from each of from different partners to learn to link it back to health equity. Thank you. There we go. So I knew it was in there. And so that's something that we continue to do. It is something that, so we want to understand from our community, our partners, what they're doing. And so that is one of the reasons why we have Dr. Gibbs here, Gibbs Cooper, to talk to us about her work and how it relates to the Health Equity Work Group. And with that,
No, go ahead. And Dr. Gibbs Cooper, are you ready for the presentation? I'll just introduce you and share your bio.
I am ready. And again, I want to apologize. Again, as I said earlier, technology can be a blessing and it can be a curse. So today I have been cursed, but I am here and I am excited about the opportunity to be able to speak with you all and just look in terms of what we can do as far as our capabilities to help advance what we need to do in the county in order to bring about a better culture of health and equity.
Great. Thank you so much for joining us. I'll share a brief bio for Dr. Sharon Gibbs Cooper, who serves as the case management software manager and a senior faculty specialist for the University of Maryland Institute for Governmental Service and Research. She possesses extensive management oversight experience in healthcare and criminal justice, which includes federal and state compliance, talent development and training, patient advocacy, women's health, quality and performance improvement, process reengineering, software implementation and training, and data analysis. Her extensive work with key stakeholders, such as the Maryland Office of Problem Solving Courts and the Maryland Behavioral Health Administration, has helped to measure public safety and behavioral health program outcomes through a data-driven strategies and process improvement. Prior to joining IGSR, of the Institute for Governmental Service and Research. Dr. Cooper served as the Director of Health Services for Health Right Incorporated, the Medicaid Managed Care Program Coordinator, and a Quality Improvement Coordinator for the George Washington University Health Plan, and the Regional Director for the American Lung Association of Maryland. And a significant part of her work in the public service and public health realms encompasses advancing social justice and health equity by integrating transformative, intentional, effective, and impactful strategies through community engagement. She's very active. She currently serves on the University of Maryland's Division of Research's Justice, Diversity, Equity, and Inclusion Committee, the University of Maryland Medical Systems Community Advisory Board for the Laurel Medical Center, the University of Maryland's Center for Health Equity Community Advisory Board, Congressman Glenn Ivey's Reentry Advisory Board, and of course, the Prince George's County Health Equity Advisory Committee. Advisory Coalition Committee. Dr. Cooper holds a Doctor of Health Administration with a specialization in healthcare quality and analytics from Capella University, a Master of Public Administration with a specialization in Health Services Administration from the University of San Francisco, and a Bachelor of Science in Public Administration with an emphasis in Healthcare Policy and Administration from the University of Southern California. So we welcome you, Dr. Sharon Gibbs Cooper, for your presentation, and we do have your picture on the screen as well. So we are familiar with your friendly face and voice to our committee. So thank you.
Wonderful. And thank you all, Cesar, Christine, Taylor, and Kim, and all the other committee members for inviting me today to chat with you about what we do at the University of Maryland. Our first slide it says, I'm part of the University of Maryland Institute for Governmental Service and Research, and it's located in College Park, right outside of the campus. So we're on Route 1 before you get to the main entrance. And so we're in the same building as one of the administrative buildings for the university. And now you can go to slide number 2, next slide. Okay, our public service commitment spans 7 decades. That's over 70 years. We were established in 1947 as a public service unit within the university. And during that 70 years, we have been successful in guiding policy, improving operations, and establishing best practices in partnership, because as we talked about this theme, partnerships with local governments, state and federal agencies, as well as community organizations. We have also been involved in national research and technology initiatives to strengthen government effectiveness, because we know we're in a climate now where effectiveness, efficiency, and accountability are so important. So we also promoted best practices in participating in those particular initiatives. At IGSR, our mission is quite simple. Just like this, it's in alignment with our committee here and what everyone else wants to do. We're dedicated to improving the well-being of individuals and communities, and that's through our work in the areas of public health, public safety, justice administration, health information software, leadership and governance, and organizational effectiveness. Next slide, please. Now, as far as our capabilities, when we go into capabilities and capacity building, because that's what we want to do as part of this committee, we want to, again, extract what skill sets folks have and what they can bring to the table. And when we identify those particular gaps, we want to be able to, what we call, associate those particular resources to those particular gaps so we can bridge them, close them, and move the needle in the right direction in building that culture of health and building a culture of equity. And an important path to that particular, building those particular elements is what we're doing today and what we're doing throughout the year and in our own private silos. We are working as far as partnerships, and we're working in essence with community engagement in order to better problem solve and be proactive, and in some instances when we have to, reactive, but at least being able to identify those resources. We partner with not only what I mentioned earlier with our local governments and state and federal agencies and community organizations, but we also partner with other universities. We have a wealth of resources here on campus at the University of Maryland, but we're also part of what we call a consortium of university public service organizations throughout the country, and working with them in order to increase or enhance our resource base to be able to provide the tools and equip us with better problem-solving skill sets in order to address those needs within our communities here in Prince George's County and throughout Maryland. My focus today, because there's a lot to talk about, and I don't want to, overwhelm you with information. So I'm going to focus primarily on the realms of applied research, the advisory services, our software technology services that we offer as well. Next slide, please. So in essence, our applied research, under that umbrella is also the program evaluation and data analysis. So I'm going to start with the program evaluation. And before we do that, I'm just going to give you a background on what we mean about applied research. What we do is we develop and direct research studies that are designed to inform and improve policy and operations and practices at the state level, at the local level, at the program level, at the community level as well. Why is that important? Because in order to study exactly what you're trying to accomplish, you need to have some sort of direction or vision, and then being able to measure that and evaluate whether or not your programs are doing what they're designed to do, hitting targeted populations or reducing recidivism if we're looking in the realm of public safety. But whatever we do, we always know that within the scope of work that we're doing, not only at the university, but with this committee, everything's interconnected. Meaning government services are connected with, social, when we talk about social determinants of health, food insecurity, social services. If anything that we have learned throughout this particular pandemic, that which has exasperated and brought this whole thing to light, we need to plug in those resources. We need to identify those resources, plug them in, and look at solutions that are going to help advance equity in all areas so that we can, again, once you hit one area, then it's a trickle-down effect to help other areas as well. As researchers and part of this IGSR, we have what we call a research arm. And those researchers are responsible for not only working among themselves, but with planners and with partner agencies and the communities to, again, identify what strategies and interventions are appropriate and tailor those particular strategies and adopt them so that it meets the needs. What am I trying to say? We can't use a cookie cutter approach. Just like when we go into a medical provider's office, we know that whatever treatment plan used for one individual may not work for me because my needs differ. And that's part of engagement, which we are doing with this committee and what we do in the areas that we work as well. And what we want to do is, as far as that particular approach is, we want to yield results that are going to lead to more effective policies, practices. And as Christina mentioned earlier, policymakers, we want them involved. We are the voice of the community. So in order to do that, that means we're out there, we're listening, and we're conveying those messages to individuals so that we can look at how we can better the system, the infrastructure here. We can look at the processes and evaluate those processes on an ongoing basis. And then we can look at, again, when we talk about quality, cost, effectiveness, and access, how can we, bring this into the mix with this equation? And then under the umbrella of what we call applied resources, we have program evaluations and data analysis. Well, with the program evaluation, as I alluded to earlier, whenever you have an initiative or any program that's designed to reach a certain community or communities, what you want to do is make sure the vision is clear. You want to make sure also that individuals that the program is designed to reach are being met. Okay. You want to make sure those services are being delivered. You want to make sure the services are quality services. So how do you do that? How do you measure the effectiveness or the efficacy of your program? That is setting up what we call evaluations. And what we do here when we work with initiatives, whether it's community or whether it's organizational or government, we based upon what we call, I like to say, inventory, or what they say in a legal capacity, discovery, is we find out what is going on, what the needs are, understanding that scope of work, and then we build an evaluation design that's going to help individuals to understand what's going on, how they're measuring up to what the program is designed to do, and then what areas are going to be in place to evaluate that on an ongoing basis. And of course, the parties or principals who are going to be responsible for effecting that change. And then walking them through the process, as I'll get into earlier, and when you're talking about change management, accountability, expectation management, and so forth. The other area that we also talk about is data analysis. And in each area, of course, you're engaging the agencies that you're working with. And a lot of times when we look at folks, and especially in the work that we've done, a lot of times systems have been discovered or implemented or developed, not having the right people at the table. And that's why it's so important, like with groups like this and with the whole coalition as a body and the care coordination, that you have the right people at the table, being able to provide that information to us so that we can serve as hear their voice and then serve as that conduit to those policymakers when they're unable to be present to do so. So with our data analysis, we all know that data tells a story. When I work with, whether it's a court system or problem solving court or a treatment agency or any other agency, I like to tell them data tells the story. And a lot of times, if you're receiving funding, that's your voice. Is it telling the story that you want to be told? Are you hitting those targets? Are you reducing, if your program is designed to reduce recidivism, are you doing that? What are your performance outcomes and what are your actual outcomes for your clients? And what are the outcomes for your systems as well? Well, at this particular time, because we're looking at those 3 levels, we're looking at measurements at 3 levels. So setting up those particular ways to evaluate that, because again, we go back to interconnectedness. We know if your clients are unhappy, we need to understand, or program is not producing what we call optimal outcomes. What would be the variables that are causing that? What are the root problems or underlying issues? The other area that we want to look at is, of course, collecting reliable data. Okay, reliable data is going to help answer those questions. And when we look at that reliable data, again, we're looking at possibly a mixed model of collection, meaning the data can be, the quantitative data and the qualitative data. And I'm going to get into this, not going to do a deep dive later, but talk about that later, the quality of data and why it's important. Because we know with the data analysis, it's the quantitative data that tells us what's going on, correct? But when you engage those involved in the system, and when I say stakeholders, I mean those patients, participants, the workers, and everyone else who was involved in this, you do a qualitative and you ask the right questions to see, and it can help you to identify why those particular, if you're experiencing any challenges, systemic challenges or not, why they're existing. And if you're not, why is it working? But again, I always encourage folks, don't become complacent when the results are what you want as far as the outcomes, because this is an evolving dynamic process. Needs change. We can't use a cookie cutter approach. We have to stay above the race there. Next slide, please. Advisory services. Our role at the university and in the community in working with government agencies as well as organizations within the communities to help assess any needs. Okay, and I know for a fact that you all have done what we call the assessment the health assessment, and which has produced a lot of information. And there are other agencies or community groups that need that kind of assistance. We provide that kind of assistance to help them look at what's going on, to be able to develop policies that will better be able to align with what their goals are, and then look for service improvement efforts that can be integrated to provide the viable approach for the agency or program to be solvable. As far as our other experience, again, we work with our stakeholders in planning, conducting organizational assessments. We do many projects involving what we call consulting, strategic planning, and facilitation. And when we talk about the area of consulting, it's very simple. What we do is we have a long history, and we provide that technical assistance to not only the public and private sectors, but also to any particular business or any particular entity that will require our particular expertise. Our expertise, we identify integrating proven best practices, not only, identifying, but applying those practices and being able to evaluate them to ensure, again, that it is, consistent or congruent with the performance of the organization's visions and goals. For the last 30 years, our portfolio has also consisted of what we call strategic planning, consultation, and facilitation. And with the strategic planning, and just in addition to that, we look at the whole landscape because we understand that our, landscape is changing, not only in healthcare, but in other areas as well, economically, politically as well. So we're looking for strategies, again, for sustainable communities, and especially those communities of vulnerable populations, marginalized communities that may not have access to certain resources to be able to thrive. So what that means is setting up a clear cut or comprehensive, or taking a comprehensive approach to meeting those particular community challenges. And that was looking at, assessments, looking at surveys, delivering interviews, focus groups, decision, formats, data queries, and other administrative reviews, just to look at what sort of information can be captured to better give that big picture of what is going on and how to take the first steps or actionable steps to be able to look at solutions after producing strategies. In addition, our broad spectrum of work includes working with municipal officials, senior management staff of various local governments and businesses, and in the private sector and public sector, as well as local and state governments. Again, part of that, establishing priorities. What is the priority? Just as we had in the beginning of this meeting, there are our priorities. That's our mission. That's what we're driving for. And then, making sure those actionable steps are, doable, flexible, as far as being able to operate in this changing landscape. And then we also serve on steering committees to help formulate economic development and public financing strategies. And again, using whatever tools are available that are going to be tailored to meet the needs of whatever that customer, client, or community organization would want. And then we also are involved in community health and needs and assessments and for various jurisdictions, and doing what we call community assessments for such, cities as Annapolis, the city of Greenbelt as well. And then moving into facilitation, we provide various approaches to help organizations achieve optimal performance. And that's, part of that particular process is change management facilitation, effective communication infrastructure, communication skills, providing clear direction, and the use of real-time data methods to make decisions that are informed. Next slide. Now I'm going to get to our technology and software services. In those particular areas, we have worked in SMART. We have worked with information technology services and systems design and implementation. Some of you may know about SMART. It stands for the Statewide Maryland Automated Record Tracking System. It was designed actually as an initiative that was birthed out of the necessity to provide a uniform platform for treatment providers to collect, their information and report upon their information. It is evolved so that it's also been used to not only collect information, but to track and monitor clients, and, drug courts have been using it as well as public, what we call parole and probation, as they, to track activities as clients and patients and participants move through the continuum of services. Historically, SMART was the state of record for over 60 Maryland Office of Problem Solving courts. Those courts consisted of veterans courts, drug courts, family recovery courts, as well as mental health courts, and over 364 behavioral health administrative funded treatment agency throughout the state. SMART is, as I mentioned earlier, a case management tool, and it provides a comprehensive approach not only to collect and track information, but to analyze performance. And when we talk about analyzing performance, it's looking at those performance outcomes at the client level, looking at the outcomes at the program level, and also at the systems level as well. And let's see, and just as a footnote here, in 2015, SMART was used by the Prince George's County Behavioral Health, and just recently they've just discontinued using it, and as far as working collectively with the problem-solving courts. But during that year of 2015, we at IGSR partnered with the Prince George's County Behavioral Health Department administration on a SAMHSA-related initiative, which was a proof of concept of interoperability known as consent to share. And that was a successful, what we call proof of concept project that was able to be executed by this particular jurisdiction and maybe another one or two jurisdictions. So that was, something that I wanted to share with you all as well. As far as information technology services, I'm not going to go into great detail, just so that you know, when we're working in the capacity of what we call protected health information or personal identifying information, there are a certain set of requirements that a organization, whether it's large or small, are required to comply with on the local, state, and federal level. And what we have done is we have, successfully gone through what we call the NIST, or National Institute of Standards and Technology audits for small organizations. So we have that skill set to help individuals and organizations, to navigate that process. We also have done HIPAA related audits as well. So we can, again, guide folks through that and provide them with information to identify any sort of areas to help mitigate any potential risk. We provide security, what we call cybersecurity, technical assistance, business process analysis, systems management, programming, technical assistance, and what we call software training for this particular software and in that particular instance. As far as our system design, when we were working in the context of the system, as we said earlier, when needs change, so does the technology have to change in order to capture whatever information is required. So individuals are being able to, individuals, agencies, and organizations are capturing what we call credible information that is going to allow them to make informed decision making and to discuss any sort of what we call viable solutions if necessary in order to remain viable and thriving in this environment. So basically, and again, I don't want to take too much time, but just to wrap things up, through what we've done through transformative research, advisory services, technology, and community engagement, we look forward to continuing our commitment to assist in building a sustainable culture of health and equity through, again, engaging in opportunities that are presented through the Health Coalition, whether it's this subgroup or the other subgroups as well, and leveraging those resources and fostering that collaboration, which is so needed when we talk about identifying evidence-based practices for improvement. And again, when we talk about that, we talk about our diverse communities and understanding that our diverse communities and diversity is very important. Because it's well documented that the value of diverse ideas and insights bring to not only the world of research, but in the world of problem solving and addressing issues and understanding and so forth. And I'm fully committed, and I fully believe that with the wealth of knowledge that we have in this committee, skills and resources, that we can work to effect change through action, policy, and accountability. Next slide. And I'm not going to go over it in detail, but I'm just going to give you a brief summary. Taylor wanted me to talk a little bit about the diversity, equity, inclusion, and justice that we're doing here on campus. Well, my particular division, which the University Institute is under what we call the Division of Research, and understanding the need for diversity, equity, inclusion, and social justice and belonging should be added to that as well. We did a climate survey because we wanted to engage folks and get their perceptions. Surprisingly, most surveys, where you're lucky to get 20 to 30%. We were very fortunate in which we had over 50% of our particular division of over 200 or close to 300 folks to participate in this particular climate survey. And it was anonymous, excuse me. So folks were, able to not only respond to the, Likert questions, responses, but also to provide text information so we could actually gather what their thoughts are and where there were areas that required, attention as well. The survey itself and the platform provided a precursor for us to help understand social capital and constructing a sustainable cultural competence continuum that is going to be in line with the University of Maryland's commitment to creating a culture of inclusiveness and belonging. And the methodology, as I said to you earlier, it was a mixed model approach that captured meaningful information and provided us with those, after the analysis, actionable steps that we've already implemented and circling back for accountability as well. Next slide. Now I'm going to open up because this was what we call information overload. So I'm going to open up the floor for any questions. So if anyone has any questions, please let me know. Don't be shy.
I see Sharon's hand.
I had a question about whether any of the applications that you've developed interface and draw data from Chris.
Good question. Well, we're always open because we have developers that work within our shop. We have done interoperability with the it was under Dr. Carter with their particular software that they were using at the health department. So we were able to allow that interoperability and for the two interfaces to talk from the primary care to the substance abuse. We're also able to effectively communicate with laboratories because we know, especially when we're dealing with substance treatment and with, public safety, those folks, drug tests is what we call a key indicator of whether or not folks are compliant. So we have done what we call that interoperability with that through HL7 messaging. We have done the interface with other particular providers using other software to be able to communicate over treatment related information, inclusive of encounters, drug testing, and so forth, in order to provide that comprehensive look at, how the individual is progressing and in their care and court-related services.
Thank you.
Thank you. Any other questions? And if you don't have any questions now, I do have another slide which contains my information. So if you want to reach out at any point outside of the meeting, this is my information along with my email. It does have our website. We are in the process of revamping our website at www.igsr.umd.edu, but it also has my business office number as well as my cell number. Okay, and last slide. And once again, thank you all for the opportunity to be a part of such a dynamic group. And I'm just looking forward to see how, we can use some of our capabilities and skill sets in order to advance the culture of health and equity. So thank you again. And I'm so sorry I was unable to show my face.
And thank you so much. I actually did have, I just had a point of clarification. So yeah, if anybody wanted to use your services, how might they, so would they just contact you? Are there some limitations?
Okay, you'll contact me and then we can set up a meeting in which, we can look at whether we want to partner or if you want us for consulting services, facilitation services, and determine what the needs are. And then from after the needs assessment, determine what sort of roadmap would be in place that will best be tailored to meet those particular goals based upon that needs assessment. And again, the process is evolving and it's ongoing, meaning it's just not one meeting. There are a series of meetings because as you go through, because things are dynamic, this may be a requirement, but then it may change the next week or so. But just understanding that those particular, communication and opening up that dialogue is essential for effective, ways to look at best practices, introduce, operations, guide operations, and of course, being able to shape policies. Once again, if there's not any other questions, thank you all again for this opportunity to work with you all. I look forward to continuing our work. And again, this is such a dynamic group, and we're going to make some transformative changes that are going to have an impact.
Thank you so much for that, Dr. Gibbs Cooper. I must admit, I went to the University of Maryland for 5 years and I passed by that building every day on Route 1 and I never knew that that is where you were housed. So
Yes.
Thank you for that new piece of information. All right, and just to transition us into our next topic of discussion. So in an effort to keep everyone informed with what has been happening with the Health Equity Champions program, behind the scenes for the last 2 months, we had these presentations where we've discussed our next steps with transitioning to an intermediary step of the Health Equity Champions resource list. And so last month we were able to hear from Ray Wallace, who did a quick overview of what a website may look like in order to house these resources and have them available to the community as soon as possible. So we've been working on an outline and just wanted to share that with you, share with you the resources that have been pulled and get some feedback. So we're able to finalize that outline and get a draft to Ray to start building out that website. So I'll go into the outline here shortly, but just to give a quick overview, the sections, it'll be broken down into an introduction page. And that introduction page will have work group context, and that's where folks will be able to access our meetings if they would like to join in the future. And then as well, we'll have this partner added events and training section. Module 1, again, as a reminder, is Introduction to Health Equity. Module 2, we didn't decide on a name for this module, so if anyone has any feedback, I can capture that today. But what it was previously called, we were calling it the Quality Health Information Module. And then modules 3 and 4 have been condensed to be more of this civic engagement piece. So this will be advocating for health equity in your community. So let me share the outline now. And thank you, Kim, for putting that in the chat. So folks should be able to access the outline. If you'd like to view it on your screen through the Google Drive, just let us know if you have any issues accessing it. All right. And then I know Teams has been wonky, but can everyone see my screen here, the Word document?
Yep.
Yes,
Okay,
we can.
thank you. All right, and so what I was just sharing, that homepage, this will be the introductory page that introduces the resource list. So this will give us context as to our commitment to health equity. It will give an introduction to the resource inventory, how this was all brought to be. And then the partnership, of course, with the University of Maryland's Terrapin think tank to really get the ball rolling and to get the process and these resources identified. And then we'll have, again, the work group meeting date and link for folks to be able to join. We'll also have a link provided to the YouTube page where folks can view all of our meeting recordings. And then there will be links to health equity trainings. So with this feature, we'll be able to have all of our partners submit any trainings that you find. And we'll be able to set those up with expiration dates, so they will automatically be removed from the website as they pass. So that will be the first thing that folks see when they come onto the page. Does anyone have any thoughts about any other materials that should be added to the homepage or that we should specifically call out here? Okay, and we can go through and we can take a deeper dive into all of the materials. And so if anyone has any feedback, feel free to unmute or pop it in the chat. And so getting into the resource inventory, so we have this idea to have it remain broken down by module. So we'll have the first module here will be the introduction to health equity. This is just an outline of some of those resources that the Terrapin think tank had originally pulled. So differentiating between health equity and equity, health disparities. These resources that you see here where it says source, these will be able to be hyperlinked with the definitions for folks to be able to read more. This is just giving context, just an overview for people to be able to visit. And then if they want to read more and be able to access some of these resources, they can click on the links. Same thing here with the social determinants of health, as well as including the visual for the power and privilege wheel. Some more materials. These are some more resources to call out. So the roots of health inequities. This is run by the National Association of County and City Health Officials. They offer 10 self-paced learning modules that focus on different inequities, different principles and underpinnings that folks can visit. And those are really great recorded materials that folks can visit. And so again, just highlighting these resources, and then they'll be able to go directly to the link that will take them to external sites. Highlighting health equity and Healthy People 2030. So just giving a little bit of context here about Healthy People 2030 and relating that back to the work group and framing our goals and objectives. Health and all policies. This was feedback from the work group that you all had told us before, bringing this up, bring up high up early in the process. We had this previously in module 4, but moving this up so folks can know as they're going through these resources, this principle, this practice and what it is rooted in. And then calling out some resources. So of course we have the PGC Health Zone, which will be able to as interactive data resources that folks can interact with. And then calling out some national and local agencies that address health equity and being able to direct them specifically to additional resource pages through these groups. And just off the bat, go ahead, Kim.
No, I didn't want to interrupt you. Well, but while you were walking through this, wanted to check with the group. One thing I just thought of is when we did a health equity training through, actually it was a course through IPHI, they provided a lot of resources for people to kind of take a step back and evaluate their own implicit bias. Is that too far off track, kind of thinking more of the self-reflection as opposed to the systematic side of things? What does the group think? Or would that be helpful for people to have kind of a little bit of a self-reflection and yeah, some assessments there?
Can you repeat that one more time, please?
Sure. So I did a training for health equity through the Institute for Public Health Innovation. And with the training, they also offered a lot of self-assessments where you could assess your personal implicit bias. And I, off the top of my head, I'm not remembering the names of some of those assessments, but was wondering for the group if that would be helpful for us to provide to the community as well, promoting self-assessment and also an area to look into the systematic assessment of health equity.
Well, here's my question, because if you offer a self-assessment and they take it, something like the Harvard implicit bias test, and it's not really a test, it's really to raise your awareness, but after they take it, what information are they going to have? Because they have to sit with the information. So I don't know how you're using it. And I also took the same training, so I'm not sure how you want to, how do you want that to impact those that are taking it? What is the basis of what you're doing?
That's a great point.
Because here's my thing, and so let me just level set. This is something that I do on a regular basis, and I've developed courses in this space, but you don't want to leave people with this information, because I know I get what you're trying to do to raise awareness, but then there needs to be something else, because if they take it, if you've ever taken the Harvard Implicit Association test, when I have given it to people, and I've done a lot of training behind it, it's somehow they feel that they are being it seems like they have to attach something to it. I'm not racist, I'm not this. That's not the purpose of that. And so I would not like to have this out there and then there's nothing to follow up. I hope you get what I'm saying.
I get it, since I also train, so I probably have facilitated the same training that Kim is referencing. And usually, we're bringing it up in context as part of a series, and we talk about our own biases, our own, like, as the facilitators themselves. So it's something that I don't know that I would, especially if this is not attached to something that's guided, I don't know that I would provide it without a lot of context. And I don't know what that context would be, maybe for the next iteration when we're talking about an actual course, but when we're just talking about the resources, I tend to agree with
Stephanie.
the previous. Yeah, Stephanie, thank you. I can't see. All I see is the S and the B. I'm like, oh. Thank you.
No, that's a great point, and which is why I'm very glad that I brought it up instead of just suggesting that we add it. So excellent. Thank you.
I think, Deborah, you have your hand raised.
Yeah, I was just going to mention just something to consider if you consider using the self-assessment. I mean, there are a lot of self-guided trainings and even resources that provide self-assessments, but they also provide some guidance as to like interpretation of those self-assessments. So when people are looking at whatever the feedback is that comes from the assessment, they have something to kind of read, or something to help them think through what it actually means. And so I guess in my opinion, I thought it would be a good idea to add self-assessments, because when you're going through the health equity training, you do have implicit bias. You do have, bias that comes out when you're going through the trainings. So it would be helpful for you to kind of be aware of those things ahead of time, so that when you're going through the health equity modules, you kind of are aware of that and you kind of look at things with a different lens. So I wouldn't be against, not putting the self-assessments there, but I do agree that maybe if we're going to use them, that there should be some like kind of feedback into how to think through, or how to, not necessarily telling people how to feel, but how to think through what the assessment means to them.
I see Sharon's hand raised.
Yeah, I was going to say, I think there may be, I think the goal here is to
kind of define implicit bias and make it okay for everybody to acknowledge that they have implicit bias. So I think Natalie Burke has some YouTube stuff on that. I think there are some kind of entertaining, interactive things that just talk about what implicit bias is, how it impacts how you view things, and again, not making a judgment, but saying that everybody has implicit bias. There's nobody who doesn't have implicit bias about something, about just about life in general, right? So people aren't feeling like they're taking a test or, you know, they're a bad person if they have certain biases, you know, that just something like that.
This is Stephanie again. I do agree with both of the two people that just spoke. One of the things that I was wondering, because I used this video, it's very short, but it does kind of dive into implicit bias, but there's no, it just provides information. And I don't know if you just want to just provide information as opposed to a self-assessment. And I'm leaning, as you already know, towards maybe just raising the awareness, and then maybe later on having some form of some platform or a workshop that will kind of dive into it. So I don't know. That's a thought. If there's a way that I can send I believe it's a YouTube, or I think it's one of the governments. I have to go back and look, but I utilize it in one of my classrooms. And it's pretty effective just to raise the awareness around implicit bias. If I could share that, or if you're interested, I can definitely do that. Just tell me where I need to send it to. You guys can take a look at it.
Yes, please. That would be very helpful.
And sorry, just another point, for the self-assessment is that even in like kind of in-person trainings where we do health equity training, there are assessments that are happening that it's more for you to reflect on what your thoughts are, not for you to share. And so the idea, I think, behind even the self-assessments and providing some just kind of, things for people to consider after they've done the self-assessment, just to allow them to kind of reflect on what that means to them. And it's not us telling them how to feel or think, but it's saying, just think, things to consider.
Okay, so I've captured some notes here. What if we take some of those implicit biases, those resources, and compile those, and then as we're piloting this some more, we can take a look at it and see if we're still missing something, or if that's getting folks to where we need them to be with implicit bias, and understanding that everyone has implicit biases, and some additional resources that are already here. And then we can go from there. Does that sound okay? All right. And then just hopping here to module 2. Before I do that, did anyone have anything else that they wanted to call out, any specific resources? Again, if you have anything, if you can, please add any links to that Google Doc that you have all have access to.
There was a couple years ago a regional assessment of areas of inequity throughout the region, including DC, Montgomery, Prince George's, and Northern Virginia. And I will send the link along to that. It's housed with them. It was done by a group of funders through the Metropolitan Washington Council of Agencies. And so I'll send the link to that. And I don't know if it fits here, but what I'm trying to do is to sort of drive in some of the local perspectives as well as the national. So I'll send you guys the link and then you can decide if it might fit here, if it might fit someplace else. And then the other thing is that they're doing actually Northern Virginia funded a very deep dive into areas of opportunity and also racial inequities in Northern Virginia. The other areas did not do that.
Was that the Northern Virginia Family Foundation or that?
Northern Virginia, it's on the Northern Virginia
Community Found. I know what you're. I think I know what you're
Virginia
talking
Health
about.
Foundation. I should know they're one of my funders. But the one that covers the whole region is the one on the MCOG website. So I will send you that link. They don't have it as prominently featured as it used to be. Northern Virginia has the areas of opportunity assessment, and but I'm really trying to keep it focused on sort of where people looking at this might be interested in looking at, and there will be an updated version of it and a slightly reframed version, I think, coming out this year at some point.
Yes.
Somebody put in the chat, they put the link in the chat.
Thank you, Christine. If anyone has any local resources or just any of the general resources we want to call out here, especially in this introductory module, feel free to either email those or send them, put them directly Google Sheet, and then we'll also figure out a mechanism in place for updating the website, the resource list. So as these reports come out, we'll be able to add those update links. All right, and then moving to module 2. For this module, I did rewatch the March meeting that we had where this came up, where we talked about health literacy and some of our goals for the curriculum, talking about health literacy and trying to center it in health and all policies. This is a combined list of some of the things that we had for the level setting with just definitions. We were really trying to focus in here about more of the organizational health literacy pieces. And then cultural humility also got brought up. And then highlighting the consumer health information, that hub, and the legislation passed around that. I'm still seeking out any resources that tie health literacy to health and all policies and can present that in a readable way for audiences. So if anyone has any ideas around that, please do share. And we also talked about renaming this module from quality health information. We never decided on a name. And I don't know if our folks from the Center for Health Literacy are on today, but that would be something that we would want to also consider before publishing the site.
And actually, Taylor, thanks for that reminder. Dr. Bauer informed me that Dr. Jackson is no longer going to be the representative for local health improvement coalitions. So they're working to find someone to fill that full-time role. But until then, we can kind of coordinate directly with Dr. Bauer. But unfortunately, she says she has a conflict with this meeting right now. So that's why they're not on today.
Thank you for that. Just going to check the chat here. Okay, so what we can do, and then here are some of the resources as well to call out, the Horowitz Center for Health Literacy, information about the hub, and then these are some more resources that are offered on the Health Literacy's website. Some of those toolkits and seeing, again, some local action that's being taken to advance health literacy. We can send this to Dr. Bauer and get some more thoughts. But before we do that, did anyone have any thoughts about missing resources or a better name to encompass what we want folks to walk away with from these resources?
Well, I don't have an idea for a name, but in the name of Dr. LaRue, who also wanted us to share that she's moved on from CASA, but I know Dr. LaRue would always make a point to add that we need to consider translation resources. So I think that maybe there's a way we can see if there's additional translation resources available or things for people to consider as they send out messaging.
I was thinking it might be nice to have a more consumer-friendly title, and I think I put in the chat something like finding and understanding health information. And that's just a thought about it, is that the quality health information sounds very like it's geared towards professionals, and we want this to be usable for everybody.
Great. And any other reactions to this module? All right, and then here for modules 3 and 4. So modules 3 and 4, they have a lot of overlapping content. This is where we focus primarily on bringing back up health and all policies. And then these are more of those resources to be able to view existing documents, governing documents in Prince George's County, and then following up with more resources for crafting your message. So in here, we just have here's the introduction to health and all policies, a little bit more about advocating from APHA, relating advocacy to public health. This was some feedback from Dr. Bauer and making sure that we were clear with folks about the connection and how advocacy can address health disparities. Linking the documents. These are from Anya's presentation when she gave a presentation to the Board of Health about health and all policies. So some of those important documents that bring up HIAP and making those links accessible to the community. And then additional resources, linking the Board of Health website, as well as a link to be able to find, for folks to be able to find their council member in Prince George's County. Here, we talked about having more resources geared towards the crafting your message. So being able to, depending on who your audience is, if there are existing templates out there. I'm not sure if there are any Prince George's County based resources that exist, if there are any advocacy groups or any groups who are centered on civic engagement who have those resources already out there. So I wanted to ask that to the group. If not, I know that there are some more general resources that we could call on.
Off the top of my head, I would say that we should look at Community Catalyst. Out of Boston, they're one of the preeminent kind of community organizing advocacy organizations. I don't know off the top of my head what they have on their website related, but they may have stuff. Community Catalyst and Build Healthy Communities might have stuff as well. That's a group of communities who were funded to to build community-driven changes in health systems within their communities.
I know my Virginia colleagues have some resources, but unfortunately, those are things that would have to be adapted because they are very specific to Virginia. But if we can't find something else, that's some place to start, but not ideal.
Alrighty, and I know that's a lot that's being thrown at folks. So those are kind of the high level updates and then some next steps. So focusing our resources on some of these gap areas. So of course, please continue to add here to the outline or feel free to email and we can discuss further. But next steps would hopefully be to start actually producing the outline into a website, being able to take a look at how that may look, and seeing, again, just going through that iterative process of seeing what we're missing, what we need to hone in on, and seeing how we can build this resource inventory. All right, I am going to transition back to the slides real quick. And so with all that being said, since this is truly an iterative process that can continue to evolve this resource list, we wanted to remind everyone of some of these matrices that we have to be able to measure the use of the website. So we'll be able to view the total number of users, new visitors, returning visitors. That's tracked off of IP address. The new visitors, returning visitors will be if their IP address has been registered more than once. Countries and cities, the site is accessed. Duration of time on the site and page, we'll be able to see what people are paying more attention on, what's taking people, what they're paying attention to a little bit more, most popular links clicked, current active users, language of users, and then how the site is accessed. If that is through a search or if it's directly through accessing a link to the site. And so again, that will be really helpful for us as we continue to refine the content of the site and think through one day if we turn this into more of a guided curriculum that is in person or online.
I'm
All
sorry,
right.
you may have said this, but how is the countries and cities being collected? Like, is that by the user or is that by the IP address?
I believe it's all going through the IP address.
Okay.
Folks don't sign into anything on the website, so we don't have a way to track that information.
Okay, got it. Okay.
And we're loosely calling this many names. It's been called the Health Equity Champions Resource Inventory. It's been called a few different things. So we just wanted to see if anyone had any ideas for trying to shorten the name. We will have, again, this will be featured on a website, so we don't want it to be too long, but we just wanted to see if anyone had any ideas for a name that encompasses all of the resources and the vision of these resources in this inventory list. And I think when we were talking with Ray, we were talking about even if we kept it health equity resource inventory or resource list would help us to shorten it down to something that would be a little easier to capture on the website. But of course, as folks have ideas, you can feel free to add those to the Google page as well. All right, well, we will go
I
ahead.
have a thought. One of the things when I was looking at the list of resources, I thought it was really, really good. Particularly the ones that Anya gave us that were Prince George's County focused, because there's no place where you would really, you have to hunt for these things. They're not very obvious anyplace. But one of the things I was thinking is it makes it much easier to use if they're annotated. And somebody can read 1 or 2 sentences. You know, they can see the title and link, and then 1 or 2 sentences about what information is in the document. Because if you're going through looking for something specific, that is really helpful. For me, I know it's really helpful. I can always speak for myself.
Yes, that is on my list to do when we get all of these resources compiled before they go out the door to be listed. They will all be annotated, so folks can have that context. Any other reactions before we jump into community announcements? All right. So a few trainings are coming up that we wanted to highlight and that will hopefully in the future be highlighted on the website. There is NIH Unite Structural Racism and Health Workshop. So the first session was actually today at 2 p.m. and they are having another session tomorrow at the same time. So these are approaches to understanding and addressing structural racism in health. There are actually a few University of Maryland-based presenters who have been presenting during these workshops. So Dr. Thomas was one of the speakers, and it should be a wonderful session tomorrow with many breakout rooms that folks can join depending on your interests. So we can put that link in the chat to register for that Zoom meeting.
And here we have a plug for the community care coordination team. Next week, our community care coordination team, we call the CCCT, will be hosting a CRISP tutorial on their social determinants of health tools and referral system. So this will be an open invite, and we will be sending out an additional reminder and calendar information next week. For those that might not be regular attendees on this meeting, but this will be next Thursday, July 25th at 11 a.m. And I'm going to put the team's information in the chat now.
And next from CCI, we have the prenatal care info sessions. There are sessions coming up. The next one will be September 10th at 6 p.m. These are virtual sessions. So you can include that link in the chat as well. And then lastly, the Maryland National Parks and Planning Commission is hosting the Back to School Jam and Fair on August 17th from 10 a.m. to 1 p.m. They are asking for organizations to attend the event and also serve as vendors for the event. So they have a form that we can send out with the meeting notes. If you are interested, here's the form that they are asking folks to fill out and then send it back to these folks with your interest if your organization is interested in being a vendor at the event. And opening the floor to any other community announcements or any other upcoming events going on. All right, well, for sticking around with us for this long, we're going to give you guys a break in August. The August Health Equity Workgroup meeting is canceled to give everyone a summer break. So your only homework is to be able to enjoy the rest of your summer. and make sure you're staying cool and hydrated. And we will reconvene on Thursday, September 19th at 3 p.m. And if no one else has any other community announcements, I will turn it back to Christine and Sir to close us out.
Thank you very much, Taylor and Kim. This has been great. Definitely another robust meeting, insightful meeting as well. Thank you to Dr. Sharon Gibbs Cooper for your insight in the work that you do, and for the work group and for our community. So if anyone does not have anything else, have a great summer, stay cool, and stay healthy, and self-care. Thank you, everyone.